Hello, my name is Avigair DAmbrosio, and here we talk about health equity and wellness through a policy lens and storytelling. Today we have a questions instead of a topic. So one question is, why do we talk about nutrition, food, when we talk about health? And I think that sometimes it's no, we will say that it's pretty obvious, but sometimes it's not, because no, like we don't have like one organization that focus on every issue of health. But here it is like a simple explanation of why. When people don't get food, people get sick. And when people don't get food, it's because they don't have money to buy food. So because of that, then they get sick, but then they cannot get insurance, so they get sick, and then they cannot afford to go to the hospital. And same thing happens, like when things happen in the house and people are struggling, and then there is a crisis, and then there is mental health issues involved, and that's why we care and we include anything like related to health. I would say like one of the issues that we can talk about is the hunger. When people are experiencing hunger, they are like more likely to get sick. They are more likely to have diabetes. They are more likely to have high blood pressure or low blood pressure. So I think that that's like one of the reasons why we include them. But sometimes you don't see that in every policy, or you don't see them together. Sometimes we talk that they are part of, but most of the time they don't seem to be related. And the other thing is that sometimes we try to do our best to prevent hunger, or try to eradicate hunger with certain approaches and programs. But there are also, like the way that they are designed sometimes are outside of the, like health. I'm not saying like outside of health, per se that is outside of health. I don't know if I'm explaining myself well, but I don't, like social, hunger is like a cause of health issues, and because of that, then we approach it in different ways that sometimes it doesn't have anything to do with a hospital. And I think that that's kind of like one of the things why like it's related, but sometimes you don't see it together, but it's part of. But like there are like different ways to approach it, and different programs that we can use, and we can approach like health in different ways. It's not just thinking about when somebody goes to the hospital.